moving on to our award ceremony. We have one more keynote speaker with some inspiring insights. Guy Spiegelman is healthcare and life sciences startups EMEA lead at Amazon Web Services. Across the world, health systems are looking for ways to better predict health events and increase patient engagement. Guy will tell us how AWS is partnering with startups and health systems to implement AI and machine learning to address these and other critical challenges. Guy, the screen is yours.
Thank you very much, and hello everyone. It's a real pleasure to be here wherever you are across the world, in Europe or the Middle East. So my name's Guy Spiegelman. I'm talking to you from Tel Aviv today, and I have the privilege to lead a great team of people that are really focused on one thing: helping the best healthcare and life science startups across Europe grow and thrive, and bringing the best of Amazon and AWS to help you do that. We also work very closely with the venture capital community that supports those startups. And today I really want to talk a little bit about how healthcare is being transformed with AI and machine learning. Many of you today, that's exactly what you've been talking about, and we're here really to support. But just a couple of bits of introduction. Okay, here we go. So Jeff Bezos started the business over 20 years ago, and really had three real principles that we still work with today: put the customer first, invent, and be patient. And that really continued from the beginning until in 2006, AWS was formed. AWS is the cloud computing arm of Amazon. Now, a lot of people think that cloud computing is a way of simply running their compute or putting some storage up in the cloud and not maintaining your own infrastructure. And that is true, but there's 175 building blocks of a digitally enhanced world. Yes, concentrating on helping you do computing, and that could be high performance computing and storage and databases, but also a lot around what you can do with machine learning and analytics and IoT and development tools. And really the message I have for you today, and I'm going to show you about it as we move on, is there's a lot already available to you from AWS and other service providers that you can use already. So if you're a startup, concentrate on what's differentiated and let us do the undifferentiated stuff. And I'm going to present a few of those tools today. Just one bit on AWS and healthcare and life sciences. We've had a practice for over 7 years now with people from the industry. I myself came from healthcare life science investing, and before that, startups in both healthcare and medical device. But my colleagues are medical doctors and bioinformaticians and people who've been in the lab and people who've developed machine learning algorithms. And we're here from the healthcare life science industry to really work with you and help you grow. And when I say that customers are really, are what we're obsessed about, ultimately it's about improving the human condition and improving the lives of patients. But while we at AWS don't work directly with patients, a lot of you do out there in the audience, whether you're a startup or a health system, or you're other supporters like us, maybe from the venture capital community. And we're here really to help the providers, the hospitals, the payers, the insurers, the government organizations, and most importantly today, the startups, do what you do best so that you can reach more patients. We have the privilege to work with some of the largest healthcare organizations in the world and some of the most promising startups really across the spectrum, whether it's digital therapeutics or precision medicine or medical imaging or provider operations or telemedicine or interoperability. We really work with many, many of the startups, and we'd love to work with you too. So just a little bit about the challenges we're hearing from healthcare customers today. And I think it's really important to listen to the customer when you're developing a solution. So what we're hearing is that if you want to deliver value-based care, data-driven decision-making, but it's very hard to implement. We're hearing a lot about physician burnout and a lot of manual processes. So it's great that you want to take advantage of data, but you really need physicians to input that data. And how are we helping the physicians be physicians and not IT people? The traditional IT model in many health systems and around the world, it really lacks agility and is sort of holding back from being able to give that patient experience a boost. The other thing that's very challenging is security, compliance, and availability. And I think being in Europe, we're really aware of that, the different regions, the different countries with different compliance laws. That makes it difficult and challenging for the health systems and startups alike. So how can machine learning help? So machine learning can actually be engaged in a number of these challenges, whether it's about improving the quality of care or operational efficiency. That's a really big ask, by the way. If you can cut waiting times, if you can improve the way doctors are matched to the right patients, those kind of efficiencies, or how surgical rooms are operated, that's going to make a big difference, allow better quality care for less money. Revenue cycle management, population and health analytics, increasing customer engagement, all of these things that machine learning can play a role. But beyond just the health system, we're hearing from healthcare startups, and maybe some of you are feeling this too, that it's challenging to do that consumer interaction. It's, to provide better patient experience online and offline, it can be expensive, and it's very hard to get the consumer feedback, often also because the consumer might be a patient whose first port of call is the doctor or the health system, and not you as the startup technology provider. In terms of core workflow, looking after diagnosis, operation, and patient care, how do you ingest and process large amounts of unstructured data? How do you build intelligent solutions? There are a lot of edge cases, and you need a lot of accuracy, and getting the incumbents, if you've had to try and work with a hospital to ask them for data to do a design partnership, that can be really difficult. And then, meeting compliance is another challenge that we're hearing. So machine learning can bring automation and intelligence to improve engagement and reduce manual processes. So you can, for example, with consumer interaction, you can more readily provide personalized content. So if you're doing any sort of symptom checker, if you already have a bit of information on your customer, you can ask them more tailored questions. And you can produce things like intelligent contact centers. AI-powered diagnosis and core workflow. How amazing have the startups been with medical image analysis and document processing and clinical notes analysis, and automated operations and smart patient care. I'll get to a few examples in a second. More machine learning happens on AWS than anywhere else. We have a full stack of services starting at sort of the framework level. So if you're a core data scientist and you have a good DevOps team, you can just be working straight with TensorFlow and PyTorch. But usually your data scientists, they're not IT people. They need a sort of service framework, and that's where our sort of SageMaker sits in. And then if you're not a data scientist, but you want to use machine learning and artificial intelligence, AWS has released some of its most worked on algorithms from Amazon.com, whether it be a recommendation engine or a text tract, and now making that available as a service that every startup can use out of the box. I want to particularly talk about an area that we see is being really of high demand, which is for ML use cases in healthcare, which is to extract, understand, and utilize unstructured data. That is one big area that I think is common to many. And for that, we implemented a new solution called Amazon Comprehend Medical, which essentially can take a whole bunch of unstructured medical text and just with a click of a button, actually find exactly what's going on in that text, and it's medical grade and it's compliant with the relevant regulatory authorities. And again, if you're a startup that is doing text analysis, you don't have to develop your own NLP engine. You can simply adopt as in a pay-as-you-go way Amazon Comprehend and get these kind of insights, the demographics, the disease indicators, the therapeutics from one click when it goes through AWS's Amazon Comprehend, and from that actually link it to ontologies or create rules to inform the rest of your application. So this is just one example. Another example, the Fred Hutch Cancer Institute in the United States is using this to sift through reams of medical records to find and help with patient selections for oncology trials, for example. Another one is Transcribe, Amazon Transcribe Medical. Essentially the same idea as Comprehend, except instead of doctors, how I mentioned clinician fatigue? Well, now with Amazon Transcribe Medical, a medical practitioner, she could be speaking to one of her patients And then through a microphone-enabled client, that will take that conversation and turn it into structured data. How good would that be if our clinicians had more time to look at us rather than type on a screen? Extracting data from images, that's another big area. Amazon Recognition, again, it's a service that you don't have to develop on your own. You can use it out of the box from us. And it's got a lot of medical applications, including in AI and radiology. And then you can also use it to extract text from data from an X-ray, for example. And if you want to work on that text or de-identify it, you can add a rule, send it up to the cloud, do processing, send it back down, re-identify on entry. Again, these are services that are available for you to start using. So many startups are using AWS to do their machine learning. Propeller, which is an inhaler for asthma. It's done very cool apps, including combining with the weather in your particular area, looking at your calendar and understanding when you had your last intake. And it could make a recommendation, for example, if there's high pollution in your area that day, perhaps you shouldn't do that physical education class outside and ask the teacher to do it inside. I mean, that's the kind of personalization that we can get to now using machine learning. I'm almost up. Just a couple of words on what we do. We have a global startup business development team here to serve the startups and the venture capital community. I'd love to hear from you. We're really trying to provide more and more specific tailored coverage to the startups here today, but also to all the startups across Europe. So please be in touch with us. What we provide is virtual currency in the form of credits. We invest time, share knowledge, help navigate where you can get resources from Amazon and AWS, remove obstacles. We don't invest cash or take a capital position. That's not our business. So alongside your venture capital funds, accelerators, we're here to provide that support, which is very tangible and also from our own experience in the industry. And there can be technical and go-to-market support. And I think that's it. I've got 1 minute less. Oh, these are some of the programs that we have. I won't go through all of them, but the Activate is a credit program and a Migrate program. And we have a special program that we call Connections, where we help startups connect to enterprises seeking solutions. And yeah, those are just a few of the things. And with 1 minute to go, I'm going to leave my email on the screen and encourage anyone out there to be in touch. We'd love to hear from you, and we'd love to be able to support the great work you're doing to improve the lives of so many. And thank you.
Thank you so much, Guy, for joining us today. And I think we'll see you again during the awards ceremony. Now, during your networking break, our jury panel has come together to deliberate and to decide on which semi-finalists will receive our sponsor awards and who will move on to the final in December. So teams, get ready. Kurt, you're joining us again, and I think you have the best job as the director and have the best job of the day. You have the honor to announce the winners. So I would say, let's hear them. Over to you, Kurt.
Thank you so much, Emery. And it's always a pleasure to announce the winners after such a great event. It's almost over. We had three fantastic and very engaging days of pitches, of keynotes, a great moderation, a lot of interaction in the one-on-ones. But now we will come to the announcement of the winners in a few seconds. First of all, I'd like to remind everyone about the great pitches that you have heard today. A lot of great startups. Digital health is a bit different compared to biotech and medtech, but as we have heard in the morning in one of the keynotes from Stephen, it is catching up, and the market readiness, also the volume of investment rounds, is getting larger and bigger and stronger. We also have heard this morning from Keith Sequeira that EIC and EIT Health, he called it the health kick, that's kind of the internal name. EIT Health and EIC will team up in a joint pilot, and that also brings you much more opportunities to get fast track into the EIC programs. And again, the EIC companies getting back to EIT Health and, for example, our Venture Center of Excellence. If you look back, I also would like to remind everyone about the preparation of all the startups. They haven't just come here as they have started maybe a year ago. they had an intensive training. First, they had to run through a very thorough process, but throughout the last 3 weeks, they had a very intensive training, a pitch training. They had mentors that supported them to really get prepared to this event today and the last 2 days. And I'd like to point out and thank especially the pitch trainers, Giuseppe Marcio, Alison Munro, and Colin Bennett. The three have trained all our startups that have pitched throughout the last 3 days in a week's program. And together with many other mentors, they really have prepared them to be on spot with their numbers, with their business plans, to be able to answer to questions, but most and foremost, to also deliver a great investment pitch. I think all of them succeeded in doing so. Second topic I wanted to mention is, of course, the prize money that we are looking for. And it is an in-kind volume, in-kind prices of 800,000 euro. So in-kind services provided by our sponsors, that really is a lot. And I'd like to ask now Guy Spiegelman. I don't have to introduce you anymore because everyone has heard your great keynote and everyone has seen that it's much more than just the credits that you can deliver and that you can provide to the finalists. And everyone here will get credits, also those that don't make it to the finals. But the special package for those that proceed includes much more. So, Guy, what's in it for those that have just participated in the semi-fin, and what's in it for those that manage even to proceed to the finals?
So thank you very much, Kurt, and well done to you and your team. Really, it's been an incredible few days, and we're at the highlight, the Digital Health Awards. To everyone that participates, to the semi-finalists, we'd like to offer $10,000 in AWS promotional credits. And after the event, you'll be sent details on how to activate those. And for those going off into the finals, the full 21 from the group, it's a $25,000 AWS credit, and that will come with a package of business mentorship and technical mentorship as well. For the digital health companies, I say, using the cloud is going to help you not just run and develop your initial product, but really scale it globally, and we're here to help you do that. So again, well done to the entire team, to all the teams, thank you to everyone that's participated, and good luck.
Thank you, Guy. Thank you so much. And I'm sure that all the startups will be more than happy about not only using the credits, but also using the additional support, including what you have presented before. Thank you so much for sponsoring this important competition. As a second sponsor, I'd like to call out Anne-France Moreau from McDermott, Höller, and Emery. Thank you so much for supporting the EIT Health Catapult and also providing a prize for the most promising digital health opportunity. Please, Anne-France.
Dear all, I would like to thank you all for your participation. We did study all of your projects very carefully, and I must confess that their quality did not facilitate our tasks. It has been a genuine pleasure to get acquainted with so many talents, even so virtually. The time has now come to make a choice, and the award for the digital health category goes to Living Brain. Thank you. Well done.
Congratulations, Living Brain.
Thank you very much. I'm very happy about that. Thanks a lot.
Excellent. Excellent. Julian is happy, and certainly will be able to use your advice and your service very intensively. Thank you. Then let's proceed to the next part. So in the finals, you will be able to win up to 210,000 euro in cash. Not all in one company, but distributed among the top winners, 40,000 euro for the first place, 20,000 euro for the second, and 10,000 euro for the last place, if I remember correctly. No guarantee on that, but it should sum up to 210,000 euro in total. and of course also an audience award that I might point out later what that means. And in order to come to a conclusion, in order to come to a decision, there was an intensive jury deliberation, and I'd like to ask Iris Öhrn to join me to give some insights what the jury did, what the discussions was. And I'd like to also thank the other jury members, Robert Mullen, Roma Jelinskate, Oliver Royce, Sophie Stralreve, and Antonio Murta. Thank you so much for collaborating and dedicating so much energy, time, and also passion to this work in the jury. And Iris, over to you.
Hello again, everybody. It has been a long day. Thank you very much to all of you on behalf of the entirely jury team. We are aware of the time you spend to prepare the SO pitches. Also, it is not easy to do it online without a physical audience. It was very high quality in all pitches. Also, you all did it within the 5 minutes. It has been a difficult decision with a lot of discussion to select the 7 winners of today's competition. Several companies were addressing similar problems with similar approaches. Thus, we gave more weight to aspects such as the level of innovation, the market traction, and the impact on the healthcare and the society. If we look at the overall impact that digital solutions will bring for solving the current healthcare challenges, then there is no doubt that we all are winners today. We are already experiencing the effects of an increased elderly population, a shortage of medical specialists, and healthcare costs that are over 11% of our GDP. So as a result, the need for more preventive, personalized, cost-efficient, evidence-based solutions is crystal clear. So that's why no matter the final results today, you are all winners. Thank you very much.
Thank you, Iris. And indeed, that's a great message that I also would like to emphasize, that everyone here who made it to the finals, to the semifinals, is a winner. But let's come to those that proceed to the finals. The first company that I will announce, the first company that will proceed to the finals that we will hold in December, the first one is coming from Finland. And I'd like to congratulate Puppet, Timo Heikkilä. Timo, congratulations. Well done.
Thank you. That's brilliant. Thank you. Thanks a lot. This is a great start for the weekend.
Looks like you were already expecting it, like you would win.
No, not at all. I have to be humble, and I think this was actually a really tough race. I really liked all the other solutions.
Thank you. But at least, I mean, when I mentioned that that the first winner would come from Finland, you could already know that it was you. So
that's correct. Yeah. So Finland wasn't overrepresented in this competition.
But great to see a prize going to Finland, or not prize yet, but having a finalist from Finland. The next one is going to the Netherlands, and I'd like to congratulate Nikolai Todorov from SmartSoft. Nikolai, congratulations.
Thank you very much. Thank you very much for the opportunity and for the faith that you put in our solution and our team. Really appreciate it. Thank you.
Congratulations to you and the team. The next one is a company that I actually know. I know the founder, and I've interacted with him quite a bit. It is a company from Germany that has already joined our Go Global programs and activities to expand to other markets like Israel. So the winner or the finalist already knows whom I'm talking about. Congratulations to Lars Wassermann from Cardilink. Well done, congratulations, and great to have you on board.
Thank you so much. Wow, this is amazing. Thank you, Kurt.
Cool. Happy to see a company that we have supported, and that even comes close from my region, but I was not part of the jury discussion and decision. So happy to see you here. The next one is also a company that we already know at EIT Health, because they have won a Head Start award in 2019, a 50,000 euro voucher. The company is coming from Poland. Congratulations to BrainScan, Dariusz Wisniewski. Well done, congratulations.
Oh my goodness, thank you so much. I actually didn't expect that. Sorry, my dogs got excited as well. Thank you so much.
Wonderful to see. Great to see that there is excitement over there.
Oh, definitely, because I know how much Head Start gave us before. So I know that Catapult is going to give us some of that as well. So that's why I'm excited. Thank you so much.
Super. Thank you, Dariusz. Well done and congratulations. Now we will move a bit southern. The next company is coming, and actually we had every day now in the past 3 days, we had companies, well representation from Spain, and this time again, a company from Spain. Paul Rodriguez from Methinks. Congratulations, Paul.
Thank you very much. It has been a pleasure to work and prepare with all of you, and hope to keep in touch with all of you. Absolutely. Thanks so much.
Well done. Congratulations. Then another company. We are proceeding. There is only 2 companies left, 2 spots left to proceed to the finals. And the next one is also a company that I know pretty well. They have been successful in our investor network. And I'm speaking about a company from Italy, Patch AI, Alessandro Monterrosso. Congratulations, well done.
Very happy to be among the finalists, and congratulations to the entire team and the other winners. Thank you.
Well done. Congratulations, and looking forward to seeing your pitch in the finals. Now we are proceeding to the last one. So there's only 1 spot left. And as you might have recognized, there was no alphabetical order. I also didn't use the order of points or the score. It really is a random order that we use to announce the winners. But I can tell you the next company also is a Head Start winner. And this company is also coming from Spain. So we have a very good Spanish representation. Congratulations to SpotLab, Jose Nistal. Congratulations.
Thank you so much.
Well done.
Thank you so much. Congratulations to everyone and to the team for supporting and helping us put all these pitches through. And congratulations to the other Spaniard. That too.
Well done. Congratulations. So, of course, this means that in the semifinal, we had only 13 participants, but that means that there is 6 companies that I could not announce. And that didn't make it to the finals. But nevertheless, you have made it into the semifinals. You had a lot of interactions, one-on-one interactions with sponsors as well, like Amazon Web Services, but also with investors. So I very much hope that this was a very fruitful engagement, and we have many other EIT Health activities that we want to offer you and that we also want to get you into. So everyone who has not made it into the finals but succeeded to get into the semifinal, you should see all of you as a winner, and I hope you all benefited a lot from that. For the winners, I already said that this morning. One of the companies, the biotech winner from last year, has just announced 2 days ago that they now, more or less 1 year after the semifinals a year ago, they have raised almost 45 million euros. So the bar is high. It's unlikely that many of the digital health companies will succeed with the first round of almost 45 million euros. But nevertheless, the outcome that you usually see from the winners through the visibility that you get and also the introduction. So also, I think the company that I just mentioned has met their investor, that now their lead investor at our EIT Health Catapult. So it's really a great place to have one-on-one meetings with investors, get in touch with them, and start fundraising. A special thanks to the sponsors again. Guy Spiegelman, thank you so much for supporting us, supporting our startups that have pitched today with credits, and the finalists even with a larger package, including additional services. That is really important and really good. Also, Anne-France Moreau from McDermott, Höller, and Emery, thank you so much also for your sponsorship. We know that this kind of services is quite expensive, and getting that for free, at least for a couple of hours that are already prepaid, that certainly helps a lot. I also would like to thank again the jury. So it's really a hard and tough job to do the activity as a jury member. You can imagine starting at 9 o'clock in the morning when Annemarie introduces the jury members. Then throughout the pitches, you always have to be fully awake, fully aware. You have to be totally focused on the startups. You can't miss a single word. You have to put in the scores. You have to fill in your score sheets. Everything is extremely well documented, as it is a competition also financed through the European Commission. So we really take care on having everything super safe, and therefore we request a lot from the jury members. So thanks again for the very intensive dedication from the jury members. I also would like to thank our partners. The main organizer is Cap Digital together with Medical Valley, and from Cap Digital, Anna Badurska, you did as always a great job. Together with our colleagues from Medical Valley, Anna Werner and Jonas Friedrich, it's great to see what you managed to build every year again. It's not over for this year. There is still a lot of preparation work, and I know you're already working on the preparation for the finals, but at least I think tonight you will have a good opportunity to open a good bottle of wine after these semifinals have gone well. Thanks also to the support from BioRN. BioRN was leading previously the Health Access Europe competition, and we have merged those two competitions and put them together. So Arantxa Encinas Lopez has presented BioRN today. Thank you so much. Also, many thanks to our colleagues from Ashfield, Katie and Michael. Again, you have done a wonderful job. You asked in the morning if I'm awake and if everything is fine. You helped in between to collect all the information that we need, and always provided lots of guidance. Also created the slides in the meantime. So well done. A big and actually a huge thanks also to Annemarie van Kampen. She, and I can tell you that because I have the possibility to sneak in backstage and to also see her when you can see her. She really always had a smile. She was totally focused on listening to every of the pitches, and was totally focused, even if you could see that, and even if there wasn't an official need. So I really appreciated your strong support, your very positive attitude, your super strict and clear guidance, and also your flexibility when I just texted that I would like to comment this morning on Keith Sequeira to make that happen and take me in. That was extremely positive. Usually I would hand over now to the directors that would have hosted the physical semi-final. I can't do that because Jean-Marc, the French CLC director, just told me that he had to get on the car and drive to another place. So I would take that over from him. Usually we would have been in Paris today at Campus Jussieu. So that's a very nice university campus with a very nice highlight tower in the middle, and high tower in the middle, and that would have been organized by Angel Santé, the French Business Angel Club. That is actually the largest business angel organization in Europe, explicitly focusing on health, together with the clusters Cap Digital and Medicine. and was on consulting a very strong supporter of EIT Health as well. So usually we would have hosted that there, but we decided that we will try to do that next year if the pandemic allows, and we all hope that this will happen. I also would like to invite you now to the finals on December 3rd. It's embedded in a 4-day series of our usual summits. I have pointed that out this morning. That will be a huge event, and there's a lot that you will be able to receive. There is first and foremost, there is a huge visibility that you will get. We have participants from all our 150 partner organizations, so all the big industry players, all the big and top universities and university hospitals, all the healthcare providers, all the global players you wanted to get in touch with before. You have all of them following your stream. I'm super excited already now, and I'm really looking forward to that. That will be an amazing event. I'm also looking forward to the Alex Costa Audience Award. That is a special award that we have started only last year, and it is actually a very sad story. Alex Costa, not everyone will know him, but Alex Costa was one of our jury members of EIT Health, and he died during the pitch session. It was a very terrible moment for everyone. But thinking about that together, and it really took us a long time to get over it, but thinking about it together, we all concluded that he dedicated his life to healthcare, to entrepreneurs, to innovators. It was really, he was a person that that contributed so much in his life to what we all have in mind: making lives better, improving health of European citizens, and supporting entrepreneurs to do so. That's the reason why we have named this prize according to Alex. And it was a very good gesture that Nasdaq has at the same moment decided to provide their Nasdaq tower, their Nasdaq display on the New York Times Square, to put Alex Costa's name on it together with the logo of the Audience Award winner of EIT Health Catapult. So I think that's a good reminder to everyone what we do that for. It's not just for money, it's not just for visibility, it is for having impact, creating impact, and making all our lives a bit better. With that, I would like to hand over and give back to Annemarie. I'm very excited, very happy, and also extremely motivated to continue working with so many great teams. Looking forward to have you all at the finals. Thank you.
Thank you so much, Kurt. Beautifully said, and a great job done by you too over these last 3 days. Ladies and gentlemen, hearing all these names means that we've come to the end of our program today and over 3 days together with 42 bright startup teams. I have enjoyed it tremendously, and I cannot wait to meet some of you again in December to see how this journey continues. First of all, well done to every team pitching today. Each and every one of you deserves this recognition among the top of European startups. Congratulations to the winners, and good luck on the preparations for the finals in December. Now, even though we couldn't give you flowers and confetti on a big stage, know that we all cheered for you from our home offices and our offices in the city. A big thank you to all of you who joined and connected today, and a special thank you to the jury, to Kurt, the speakers, and our partners and sponsors who made everything possible.